My physiology practice is about day one competency. First, all veterinarians in every nation are responsible for the delivery of national veterinary services. That is, service provided under the legislative framework and the auspice of the governmental authority of a country to implement animal health to assure the health and well-being of animals, people, and ecosystems. The term veterinary services, which include both public and private components of the veterinary profession involved in the promotion of animal and public health as well as animal welfare. National veterinary service should be able to meet standards adopted by each country, but should also be able to comply with appropriate international standards and recommendations. Although only some veterinarians will focus their career on the public component of national veterinary services, all veterinarians, regardless of their professional area of practice after graduation, are responsible for promoting animal health, animal welfare, veterinary public health, and food safety. Veterinarians in the private sector frequently act as subcontractors for the public component of national veterinary services and many instances opt for career change into the public sector. As such, veterinary education is cornerstone to assure that the graduating veterinarian not only has received a level of education and training that ensures should overall competencies, but also has the required knowledge, skills, attitude, and aptitude to understand and be able to perform entry-level nation veterinary services tests that relate to the promotion of the animal and public health. In addition, basic education that provides the minimum competencies is a basis on which veterinarians, whether working in the public or private sector, can be built expertise through on-the-job training and quality postgraduate continuing education. The question, who is a veterinarian, may seem like it has a simple answer. Someone who has been awarded a veterinary degree, but what does having a degree mean? Some who graduate from the university in Korea may have different skill set from the someone who graduated from university in USA. A few countries have made efforts to define and harmonize the combination of knowledge, skills, and experience that new veterinary graduates need to have when entering the veterinary profession. So why day one competency is important is many students are unclear about the range and the level of competency required of a new veterinary practitioner. Students seem to have had difficulties interpreting the day one skills, and up till now, there were no clear competency objectives for the clinical use of the VetMed program. The day one competencies are epidemiology, emerging disease, disease prevention and control programs, food hygiene, veterinary products, animal welfare, veterinary legislation and ethics, communication skills. The day one skills listed are the skills that you will be expected to perform when you have completed your studies, without any supervision from qualified vet or veterinary nurse. There are many other skills required of a veterinary practitioner. These may be skills of which you have knowledge but which you will not be expected to perform without supervision as a newly qualified vet. So first thing, the epidemiology is the study of factors affecting the health and illness of population and serve as the foundation and logic of intervention made in the interest of veterinary public health and preventive medicine. Specific learning objectives for this competency include the day one veterinary graduate being able to know and understand the general principles of descriptive epidemiology and understand and participate appropriately in an epidemiological inquiry in case of occurrence of a reportable disease, including collection, handling, and transport of appropriate specimens or samples. The next thing is emerging and re-emerging disease. Emerging disease is a new infection resulting from the evolution of change of an existing pathogenic agent, a known infection spreading to a new geographic area or population, or previously unrecognized pathogenic agent or disease diagnosed for the first time. A re-emerging disease is a resurgence in a defined time period and location of a disease considered to have been eradicated or controlled in the past. Both emerging and re-emerging disease have significant impact on animal and public health. Specific learning objectives for this competency include the Day 1 veterinary graduate being able to define emerging disease and re-emerging disease and provide contemporary examples, and detect suspicious signs and report them to the relevant veterinary authority, and understand the reason hypothesis to explain the emergence and the emergence of disease. The next thing is disease prevention and control programs. Whether or not approved, managed, or supervised by the veterinary authority, include movement controls, vaccination, and treatment. Specific learning objectives for this competency include the Day 1 veterinary graduate being able to know which disease of animals require compulsory notification by the veterinarian, and describe established programs for the prevention and control of common zoonotic or contagious disease or emerging re-emerging disease. And the next thing is food hygiene, which means all conditions and measures necessary to ensure the safety and suitability of food or animal origin. Specific learning objectives for this competency include a Day 1 veterinary graduate being able to understand and explain on farm food safety practice, and participate in slaughter inspection, and understand and explain the integration between animal health control and veterinary public health. The next thing is veterinary products. Veterinary products means drugs, insecticides, vaccines, and biological products used or presented as suitable for use to prevent, treat, control, or eradicate animal pest or disease, or to be given to animals to establish a veterinary diagnosis, or to restore, correct, or modify organic function in an animal or group of animals. Specific learning objectives for this competency include the Day 1 veterinary graduate being able to explain and utilize the concept of drug withdrawal time as means to prevent drug residues, and know the appropriate use of drugs and biological to ensure the safety of the food chain and environment. The next thing is animal welfare, which means how an animal is coping with the condition in which it lives. An animal is in a good state of welfare if it is healthy, comfortable, well nourished, safe, able to express innate behavior, and if it is not suffering from a pleasant state such as pain, fear, and distress. Good animal welfare requires disease prevention and veterinary treatment, appropriate shelter, management, nutrition, human handling, and human slaughter. Animal welfare refers to the state of the animal. The treatment that an animal receives is covered by other terms such as animal care, animal husbandry, and human treatment. Veterinarians should be leading advocates for the welfare of animals, recognizing the key contribution that animals make to human society through the food production, companionship, biomedical research, and education. Specific learning objectives for this competency include the Day 1 veterinary graduate being able to explain animal welfare and the related responsibility of owners, handlers, veterinarians, and others responsible for the care of animals, and identify animal welfare problems and participate in corrective action. The next thing is veterinary legislation and ethics, which is an essential element of national infrastructure that enable veterinary authorities to carry out their key function, including surveillance, early detection and control of animal disease and zoonosis, animal production, food safety, and certification of animal and animal products for export. Furthermore, veterinary education establishments should teach ethics and value issues to promote high standards of conduct and maintain the integrity of the profession. Specific learning objective for veterinary graduate being able to have a general knowledge of fundamental of national veterinary legislation and of specific rules and regulation, and understand and apply high standards of veterinary medicine, medical ethics in carrying out day-to-day duties, and provide leadership to society on ethical consideration involved in the use and care of animals by humans. The last thing is communication skills. Effective communication skills are as important to success in veterinary medicine as technical skills. In general, communication entails the exchange of information between various individual, institutional, and public audience for purpose of informing, guiding, and motivating action. The application of the science and the technique of communication involves modulating message according to the situation, objectives, and target audience. Specific learning objectives for this competency include the day one veterinary graduate being able to communicate technical information in a way that the general public can understand, and communicate effectively with fellow healthy professionals to exchange scientific and technical information and practical experience. So, conclusion is the minimum competencies needed by graduating veterinarians to be adequately prepared to participate in national veterinary services, both public and private sector. At the entry level, high-quality veterinary education is of critical importance to efficient veterinary services, and improving the quality of the veterinary education is therefore a key component of any plan to improve governance of veterinary services. The minimum competencies include the public good component of veterinary activities. Thank you.